We are diving into a big, often scary question for parents to be: does taking paracetamol during pregnancy cause autism in children? You might have seen headlines or posts online that make this claim, and it's understandable to feel worried. So, let's break down the science and separate the facts from the fear. First, what is paracetamol? You probably know it by brand names like Tylenol in the US. It's one of the most common medications used to relieve pain and reduce fever, and many pregnant women have been advised to take it. The concern comes from some studies that found a statistical link between paracetamol use in pregnancy and a higher risk of autism or ADHD in children. Some of these studies even measured paracetamol levels in umbilical cord blood and still found this association. This sounds alarming, right? But here's the crucial part of the story that often gets left out. The key phrase here is statistical link or correlation, and as any good scientist will tell you, correlation does not equal causation. Just because two things happen at the same time, it doesn't mean one caused the other. So, researchers decided to dig deeper. The largest and most comprehensive study on this topic involved nearly 2.5 million children. Initially, they also saw that small link between paracetamol use and autism. But then, they did something brilliant. They looked at siblings. They compared siblings where the mother took paracetamol during one pregnancy, but not the other. They also accounted for shared genetic and environmental factors within the family. And what did they find? Once they controlled for these other factors, the link between paracetamol and autism completely disappeared. This strongly suggests that the initial association wasn't caused by the medication itself. Instead, it was likely due to other underlying reasons, like genetic predispositions that might make someone more prone to both needing pain relief and having a child on the autism spectrum. Or perhaps the very reason for taking the medicine, like a severe infection, played a role. So let's bust some common myths. Myth number 1. If a mother took paracetamol, her child will definitely have autism. The reality is, there is no proven causal link. The biggest and best studies show that the connection is not causal. Myth number 2. Science confirms paracetamol causes autism. This is false. There is no scientific consensus on this. In fact, the highest quality evidence points away from a causal relationship. Major international medical organizations, like the American College of Obstetricians and Gynecologists, have reviewed the evidence and state that no studies have proven paracetamol directly causes these conditions. And myth number 3. Paracetamol is dangerous and should be totally avoided during pregnancy. The reality is, when used correctly, medical experts still consider it one of the safest pain relievers available for pregnant women. What is often overlooked is that untreated high fever or severe pain can be harmful to a developing fetus. The risks of not treating these conditions can sometimes be greater than the potential, unproven risks of the medication. So, what should you do? Here are some practical, common-sense recommendations. First and most importantly, always talk to your doctor or pharmacist before taking any medication during pregnancy. They can give you personalized advice based on your health. Second, if you and your doctor decide paracetamol is needed, use it only when necessary. Take the lowest effective dose for the shortest possible time. This is good advice for any medication, not just paracetamol. Third, don't ignore pain or fever out of fear. These symptoms can be signs of an underlying issue that needs attention, and high fever itself can pose risks to fetal development. Contact your doctor to figure out the best course of action. And finally, don't stop unnecessary treatment because of unfounded fears you read online. The risk of an untreated condition is often much more real and significant than the unproven risk of a well-established medication. The decision to take any medicine during pregnancy should be a thoughtful conversation between you and your healthcare provider, weighing the real benefits against any potential risks. I hope this clears things up and eases some anxieties. If this video was helpful, give it a thumbs up and subscribe for more fact-checking videos.